The following segment is sponsored by Fairfax Radiology Centers. As we continue to focus on our health and well-being, today we are learning about what radiologists do and how they help patients. I am joined now by Dr. Cullen Ruff from Fairfax Radiology Centers. So good to have you, Dr. Ruff. So let's just start kind of at the very beginning. What is a radiologist and how is a radiologist different from a doctor?
Well, we are doctors, so radiologists go to college, go to medical school, and then we do specialty training in a field, just like a surgeon, a pediatrician, gynecologist, internist, whatever. So we do an internship, a 4-year residency. Most of us go on to do additional years of specialty training, and then our specialty is human imaging. So we interpret images and we use those sometimes to do procedures on people.
Okay, so I'm guessing maybe there are different types of radiologists?
There are. So we all do the same basic training to start, but then because there's so many different technologies and different parts of the body, people do tend to specialize, and we have radiologists who specialize in everything from pediatric imaging to abdominal, pelvic, chest, neurological like brain and spine, musculoskeletal, joints, that sort of thing. There are docs who do vascular interventional procedures, so they're not just doing diagnoses, but they're doing treatments as well.
So why don't patients usually see radiologists? Is it because it's more of a specialty?
Partly. By the sheer number of studies that we read, there's no way that we could meet every patient, and it's usually not necessary. If you're coming in for a standard chest x-ray, a bone x-ray, you don't necessarily need to meet the doctor who will do the reading. You'll meet the technologist who performs the study. We do get to meet some of our patients when we do certain types of procedures or when we're just going over findings that may need a little bit more in-depth review together.
The next question I have, I think, you hear sometimes people just being a little bit fearful of radiation and how that can affect your body. I mean, clearly, they put the big armor on you. What do you say to that? Should we be scared?
Most of the studies we do don't actually use radiation. If it's something like, I shouldn't say that, plenty do, but most of the studies that we do with ultrasound, MRI, these don't use radiation at all. So as far as we know, these types of technologies are perfectly safe. Regular x-rays of a bone, a mammogram, these are very low dose, and the benefit of having the study by far outweighs the risk of that small dose of radiation. Where we pay attention is for things like CT scans, which do have a higher dose, and so we're a little more cautious or judicious using those on young people when not really necessary. But the scanners have gotten more and more efficient with lower dosing, and so the benefit almost always outweighs any risk.
Okay. Who is most likely to need a radiologist? I'm sure you'll probably end up having to see one at some point, right?
Sure. So our field is a little different because we have the patients that we serve, but we also serve the doctors and other healthcare providers who refer patients to us. Okay. So a lot of what we do is go over studies with the doctors who are ordering. So if you see a surgeon or an internist or whoever and they want you to have a study, a lot of times we're going over the studies with them as well as interpreting it for the patient.
Okay, good to know. You did mention referrals earlier. Do you always need a referral, maybe by your primary doctor or some other doctor, to see a radiologist?
In general, you do, yes.
Okay, good to know. And if people want to, schedule a consultation or, reach out to you guys, I'm guessing somebody would, like you said, refer. And then how do we connect with you at Fairfax Radiology Centers?
Well, we have a business office that handles a lot of our public connections, and certainly doctors who need to talk to us can always get us on the phone. We staff 3 Inova hospitals 24 hours a day, and then we have 20 offices where we have people staffing at all hours. We're quite available.
And you guys are right here in our backyard, Fairfax Radiology Centers. Dr. Ruff, thank you so much for empowering us all with a little bit more knowledge on radiology.
Thank you for having us.
All right, we've got more of Good Morning Washington coming up right after the break.